No filter. Okay.
Hello. We are at ViVE in Nashville.
Yes.
And we are maybe live. We'll find out in a minute as soon as our trusty testers let us know. I'm Lisa Berry. This is Kat McDevitt. This is the Health Tech Talk Show. We have a very special guest with us and many more coming today.
Yeah, here we are. So we have Liddy, who we met at the bar. Like, I feel like how we meet all of our guests. It was a real dinner.
It
At
was an
Health.
actual dinner. Yes, it was at Health back in October.
Wonderful.
The conversation was robust and I loved it.
Yeah. So Lisa told me, because I didn't get to sit by you. I was sitting somewhere else, whatever. And we were walking to the next bar and she was like, oh my God, I love her so much. She's going to come on the talk show. Oh my gosh. So Liddy, so tell our loyal fans, all 1 million of them, who you are, what's the story, and what are you doing?
So my name is Liddy. Hello, everyone. I am a podcast host myself. It's called Access with Liddy. So I focus on interviewing startups and just really getting a platform ready for them in order to network about access to care. In my day job, I do work with a lot of executives and healthcare leaders based here in Nashville. And then just like my background is in public health, really had an interest in healthcare administration, decided to go down that path, and now I'm here just really making sure that I'm connecting healthcare leaders across the healthcare ecosystem. So that's probably a lot of what I shared with Lisa in my background. And yeah, that's about it.
And can you tell us more about, it's the Nashville Healthcare Council, right? Can you tell us more about like what happens in your day job?
Yeah. So with the Nashville Healthcare Council, we are the go-to organization for all healthcare leaders, especially in healthcare companies when it comes to what's happening here in Nashville. If you didn't know, Nashville does have a $97 billion industry when it comes to healthcare. So there's a lot of decisions that are happening here. And it's just really been just a great opportunity for me to be in this ecosystem, but also just recognizing the decisions that are made allow us to be able to move forward as an industry. I know that sounds like very typical response, but it's also one of those where a lot is happening here. And I mean, ViVE being here 2 years, you know, out of the 4 years that it's been in existence is a true testament to that. So, yeah.
So from what we hear, a lot of other cities try to replicate what Nashville has done with the healthcare sector.
Okay.
You know, I'm from Atlanta, same kind of thing. You know, it's a super fragmented market, right? And I think we used to have a stronghold in like the freaking 90s with healthcare technology, you know, with McKesson being there, old timey stuff. And since then, you know, things that people have been acquired and things have moved around, and it's a fragmented provider system too. What do you think the secret sauce is for Nashville?
Ooh, I would say the secret sauce is that we have support from all levels in order for healthcare to be a thing here. Our organization was actually created by the Nashville Area Chamber of Commerce. So that means there was an economic also like interest in making sure that healthcare was a thing here, but also over time you have a lot of healthcare companies that are based here, and as a result you have it where Nashville is one of those, like, they will take, you know, the first invite, you know, the first meeting with you, but it's also relationship heavy city. Like, you have to have a just personable approach to everything, and then we know we can get things done. So I would say that's one of our secret sauces here, where the connections is a big thing, the relationship is a big thing, but also understanding that a lot of decision makers want things to happen here in a good way. So yeah.
And I mean, there's also a lot of companies started here and entrepreneurs who are part of the new administration. So there's also sort of a political power connection too. Like anything you can say about sort of the political connection as well. I mean, you said relationships, political stuff is relationship based. So like anything about sort of what that's looking like for you and also for all of the entrepreneurs who are, you know, working on healthcare businesses here.
I will not be able to say anything. However, what I will say is that relationships matter here, and we do a lot of things as a result of the relationships that are being built here. And it's just one of those where it's just like, hey, we really want to ensure that the hope and feel of this is that anything that is done here is for a good of everyone, and when it comes to healthcare. So as far as we go.
Yeah. So, you know, another thing, I'm going to keep going back to Atlanta because we think we're like so big.
Oh, listen, that was like my second hometown.
We think we're so big, and we are a big city, but again, super fragmented. And I think what the saying that I hear from Russ Lapari, who runs the Health Connect South conference, you know, he's always like, you know, I look at Nashville and we all have a pile of Legos, but Nashville built something great. So, you know, you guys built a castle, which is fantastic. So, well, you personally, what attracted you to this role?
Honestly, I've always wanted to work with leaders. And so this comes from a personal place. I'll just do a little tangent right here. So my younger brother had sickle cell disease. And so growing up, we spent a lot of time in the hospitals and health systems and just having to interact with a lot of different teams. And so knowing that there were huddling, they were doing a lot of things as far as coming together to make decisions that impacted my family. I immediately knew once I was in college, like, oh, I want to work with the decision makers. I want to make sure that they have the resources and the connections in order to make the best decisions that they can. And so as a result, when this opportunity was presented to me, it just made sense as far as that, where I can take my background in public health, healthcare administration, and just my understanding of the healthcare ecosystem and really support this leaders who are wanting to make things better. And so as a result, this was just like a really match made in heaven, honestly. So just really happy about that. Yeah.
And so are you and your team responsible for putting on sessions?
Yes.
Okay.
Nashville
So here's the thing about that too, and this is not Atlanta based, but just in our industry, everybody was like, "Are you going to this thing called sessions?"
Yeah.
This is like because last year, the year before,
it
last
sold
was the
out
first
2
year,
years
right?
in a row.
Yep.
Okay. Yeah, and we were all like, "What is this thing?" And it was a little bit like JPM and South by Southwest, where like you had the main thing, but then there were 1 million side events.
Exactly.
So like tons of people were coming in, and I did not go this past year, but some of our team did.
Yeah.
But the year before I did, and I was super impressed. So
Awesome.
what was the model for that? Was it like a JPM type thing where you have multiple side events, or like tell us about that?
So the thought process behind that is we knew that like as an organization, we do a really good job in bringing and doing programming and having like convenings happening. And it was just like, well, it's time for us to have a conference to showcase that, but also to be able to expand the relationships that we've already built here in Nashville. And so the thought process is that we don't want to do an entire week because that can be exhausting. I mean, we're here at ViVE and we all know by the third day, it's like, oh my gosh, my feet, soak them in Epsom salt. We all know that, but we knew that we wanted to kick it off and actually be the host of the actual event. So kicking it off with 2 days, or this past year we did 3 days, going back to 2 days of programming, and then going for the remainder of the week so that we have a lot of great partners and members within our organization. So why not allow them to be able to highlight and talk about what's going on within their own respective sectors and industry and create a week out of it. Now you have people who are able to fly in, spend the week, they're meeting multiple people in 1 week. So it's like, oh, we're actually doing what we've been called to do, which is make this the healthcare city, which is it is, but also convening to strengthen and elevate Nashville. So yeah,
it's really great. Yeah, as somebody who puts on an event, like hats off to you.
Yes,
and hugely successful, really interesting.
Yeah.
Can you tell us a little bit about some of the entrepreneurs that you're excited about working with? Like give us some highlights.
Play favorites.
Oh my gosh, on the spot.
Yeah. Tell us about them.
I do not have I don't know if I have any favorites per se, but I will say one of my mentors who has been a great entrepreneur is Michael Bertram, Dr. Michael Bertram. And so he's
Tell us about him.
Oh my gosh. So he is one of the founders for the Nashville Entrepreneurship Center. Okay. So are you familiar with that organization? So just he is like the go-to person that whenever I have a question about like how to make something really good or make something relatable and actually work, he's the person who will be like, okay, yeah, that's going to work. Oh, actually, no. That's not going to work. And he's actually on our board at the Nashville Healthcare Council as well. So that's also one of the great things to have, where you have individuals who have that entrepreneurial spirit, who has done a lot of great things, who are now being able to provide guidance to us as an organization and support us in the work that we're doing. So I'll say as far as one of my favorite entrepreneurs is probably him. He's probably not as an entrepreneur now, but he's done so much in the past that it's inspiring not only to me, but a lot of other healthcare leaders too. So
yeah. What companies are kind of standing out in the field? Like when you look around you, there's obviously some big ones. There's some big ones. There's little ones. Like who's coming up? Yeah.
Ooh, in Nashville or just nationally?
Nashville.
Oh, you do know we have a lot of businesses here.
I know.
Right?
I mean, you gotta have a few. Just name off the top of your head.
Honestly, I can't. I can't. I don't. I know.
You gotta pivot.
I know. I can't. It's okay, like that's one.
I have a question about your mentor. So, a lot of times we got all these, CEOs, and they make $1 bajillion off their exits, and then they buy a yacht and they sail off. What do you think it is about Nashville, especially your mentor? Like, what's like the part of them that makes them come and give back? Because like far as I know, he didn't have to do that.
No, you didn't. I would say it goes back to like that secret sauce that we have here where it's relationship and people also wanting to give back. I don't think you've ever come across any Nashville leader here who's like, you know what, I'm just gonna exit and go back, like, and like leave everything. Yeah. They're always doing something new. They're always either starting in another company or they are like being a mentor to like those who are young professionals. It goes back to that secret sauce, I think, which is the relationship thing. And I think that's one of the things that makes us as an ecosystem here unique compared to other ecosystems across the country when it comes to healthcare, where you can actually have like people are personable. You know, they want to, I mean, it's like that Southern charm, maybe. It's like people are personable. I mean, as someone, I'm from Boston. So as someone from Boston, it's just like, well, why are you smiling at me? What do you want? It's like, no, the genuine relationship.
They want to talk to you.
They want to talk to you. They want to know who you are. And they also want to be able to establish relationships so that we can actually make things move forward within the healthcare industry here and beyond. So
I realize it's kind of a cliche for someone like flying in from somewhere else and being like, guess what the taxi driver told me? But honestly, every single Lyft or Uber I've taken, someone's had a long conversation with us about what's going on, like what's happening.
There's a personable touch here. Yeah.
Exactly. Definitely people are very interested in talking. And like, so if somebody is like, I want to do business in healthcare in Nashville, what should they do? How should they start?
I would say first, starting off with our organization. I know it's a plug, but it's one of the go-to where it's like, as a council, we are here to bring healthcare companies and leaders together. So we're the go-to in order to start that. Starting off with us, and then just being open to like different, going to like different programs, and just also being open to just talking to different people. Like, don't be selective of who you're talking to because you never know who you're talking to and what connections that they have. So those are some of the things I would definitely recommend for someone coming here, and then just be ready. Things are going to happen.
Moving and shaking. Love it. Well, thank you, Liddy, and we're going to see you around most likely. It seems like we have the same things going on, and we'll unprofessionally get our next guest on here. But hey, thank you, Liddy. We'll see you soon. Everybody, follow Liddy on the LinkedIn. All right. Just whatever. It's a talk show. You just come and go. You just come and go. There you go. No, just go. Yeah. You're good. All right. We have our next guest. He does the AI. Oh my gosh. Okay, so we got Prashant here. You know, we had dinner with him last night. They can't. Prashant, you're talking about yourself. You're making this adorable thing about us, but you aren't holding the mic. So do it again.
Beauty and brilliance in one package, and I'm not talking about myself. I'm talking about the wonderful Lisa and Kat.
That's what I'm talking. This is what we have this guy on.
And they exemplify. They exemplify that.
His way on the show. That's all I gotta say.
Exemplify that in loads.
We take bribes, compliments. We take all those.
We like dinners.
This is not a real news show. That's right.
Yeah, we are not. Once again, everyone, we are not journalists. Please please never mistake us for actual. There are plenty of actual journalists here.
Is a talk show. But yeah. All right. Oh, so Prashant. So you tell.
You just hold it.
Just hold it. Yeah, just doing great. Here, don't hit. For whatever reason, it doesn't like that. So just do this.
If you are once again watching the show and saying, why is their rig still so bad? You need to sponsor us so we can buy better technology. Thank you.
We take Apple Pay.
So we are not doing well.
Tell our loyal fans what you do. What's the story? What's happening?
Yeah, so my claim to fame, and I'm pretty famous, is that I know Kat and Lisa very well. And I like them even more because against their better judgment, they've decided to invite me on the show. So for that reason, I absolutely love the fact that I'm here. We are actually going to talk about some serious stuff too, believe it or not.
What?
He has an agenda. Yes. We do not.
Yes.
We never know.
Or at least I hope that that's the excuse I told my boss I need. Emily over here.
Yeah.
So,
hey, Emily. Just to be clear, audience, you can't see, but Prashant does have a full-time chaperone. She is standing behind the camera and glaring at him. So okay, tell us what you really do. All right. Yeah, she has real jobs.
Prashant Natarajan, I am the Chief AI Officer of Velatura Public Benefits Corporation. I am also on the board of the Interoperability Institute. Velatura develops software products and also runs trusted data sharing organizations and health data utilities across multiple states in the United States. Very glad to be here. And in addition to that, I've kind of also known for a couple of my books. which have done rather well. My daughter's college fund thanks all of you who are going to buy them.
Love it.
Nice.
Wait, I've read all of your books in another life. Looking forward to it. Tell us about your books.
Is your daughter going to community college?
Um, well, that's where she may
cost,
that's where she may end up, given the royalties I'm getting now. So, but that's okay. It still pays for community college, you know.
It pays for something.
Yeah,
Unlike the Health Tech Talk Show.
correct. Well,
No disrespect to community college.
no
Awesome.
disrespect at all, and no disrespect to any 529s that were hurt by that comment either. So the books actually are a few books, most of them on data and analytics. The business intelligence was the HIMSS book, and then a couple of books on big data, machine learning, and AI, and one on oncology and the use of technology for easier detection and treatment of cancer.
Is there any romance theme going on in any of these books?
Yes, I absolutely love my own books.
Oh, it's perfect. Shut the front door. Jesus Christ. Prashant, tell us what's gonna let's switch gears. Tell us what's gonna happen in the new administration with regard to AI.
Prashant, like us, also thinks he's funny, so we think you're funny. You think you're funny, and we love it.
But again, the big difference is I also laugh at my own jokes.
Oh, we do too.
So
We think we're hilarious.
okay, but I think you're hilarious too.
Yeah,
So
there
that's-
we go. A few people do. Anyway, okay, so what's going to happen? We got the chai going on. We got Elon Musk coming in and doging all the things. They clawed back the Biden executive order on AI. Jesus Christ, like what's happening?
I think there's a lot happening, and my personal opinion in this case, I'll start with that, not speaking on behalf of Velatura right now, is that it's a good thing. So yes, there is a lot of disruption. There is a lot of change, some bit of uncertainty, obviously, as it always happens. But I would say that on the AI side of the house, there are very many good things that are happening with this administration that I strongly support. So I think that once we get past some of the change that is happening right now, the net result will be health and medical AI and patient-centered AI, patient-driven AI is actually going to get a huge uplift in terms of what it can do compared to what happened, let's say, in the last 5 to 10 years. I think the technology is also ready. You could argue that 5 years ago, the technology wasn't quite there, and we needed armies of data scientists to essentially put the value of machine learning into healthcare providers, life sciences companies, etc. With generative AI, that has changed completely. So I think the technology readiness with some of the legislative changes, and should I say, the retreat of regulatory capture,
that even though there's more that different companies in healthcare can do around AI, you still have a huge amount of concentration of power in a few very large firms who control a lot of AI. Large firms love regulatory capture. They love it. So how is this going to result in a retreat of regulatory capture? I want to. I support it.
Strong support.
Yeah.
So I would say there's a few things happening over here. And again, I don't know if this will all come to pass this way, but this is my hope. Maybe a prediction, and if not a prediction, a hope. And what I would say is a couple of things. I think one of the things we will see with this administration, specifically based on what they have announced in public, is really more of a focus on innovation and businesses being able to build
Love
more.
business.
And the reduction of barriers of entry to new innovative players to do stuff with AI, frankly. And I think we are already seeing some of that happen with a call for more inputs from people who were traditionally not called there. So I think that's the first thing. The second thing I see is I also see an increase in and state level control of your health data as opposed to federal mandates only.
I agree with that.
Yep. So when that happens, I see the role of folks like you, Lisa, at Civitas, all the various interoperability players actually playing a big role there, including Velatura, because we see that as that happens, because the structures are in place, and still health data in the United States is primarily driven by state access, state
Agreed.
control. I think that's going to change things also.
Mhm.
The third piece I see is that your other question, Lisa, was you see a lot of big companies get in. That's absolutely true.
Yeah.
But I would argue that there are two things there without having a point of view. I think less regulatory capture is always good, as I also testified in Congress. We don't want
Ooh.
one or two companies what regulatory capture is. So I would argue that having more companies, even if their goal is regulatory capture, actually democratizes
Competing
regulatory
in
capture.
regulatory
Competing,
capture.
yeah.
Wow,
I like it.
Exactly.
competition all around.
Competing, right? So I actually like to see more players, but I also think it's not just going to be more players, it's going to be smaller players. And finally, I'll just say this. I think that AI is making the era of the small company more possible than the monopolistic folks who used to exist.
Yeah.
So I think that if healthcare has to transform, and if this administration is very keen on doing that, I actually see a huge fillip upwards for health AI, if that makes sense.
It does, and I think there's also something interesting in what the approach of the prior administration was that we need to talk about, and that is, I think the answer that was starting to unfold, because they, as you recall, the prior administration released a AI strategy on like January 20th, which was like interesting timing because your time is up. But it seemed like the focus was around these AI assurance labs. And it seems like, as far as we can tell from any little signals kind of coming out from the new Trump administration, that they're not interested terribly in AI assurance labs. And they don't want there to be a really strong federal regulatory framework for AI, and specifically health AI. What you're saying is things are going to go back to the states. That's good for lots of reasons. And also, what happens to this AI assurance lab landscape?
Yeah.
The idea of an AI assurance lab is something that I have supported. So I want to be clear that I have worked with Chai to a certain extent in order to define how these might look like. On the other hand, even as I've supported it, the reason I've supported it is because I think there is always a need for trustworthy, responsible, interpretable, and explainable AI in healthcare. Simply because we are asking AI to take important decisions in the new world, or we will be. Obviously, the thing in medicine is always life or death decisions. Of course, I want to know if an AI is being used, even if it is going to prolong my life, if that makes sense. Right? Of course, I
In
like
all
to know much
cases.
more about it if it's going to impact my life, but positively also, number one. Number two, I think it's fundamentally a human right and a citizen right for us to control our data and to decide how that data is going to be used specifically for us or indifferent to us. And I think what we see today is yes, patients get benefits from AI when institutions put it in place. But what about patient control of their data? What about a patient wanting to say that I don't want my data to be used for this use case because it doesn't fit my morals or my religious beliefs or my political beliefs, versus I absolutely want to open this up in return to get paid. So if I am giving my data up, I'm a diabetic, I'll say that, for a diabetic juvenile diabetes thing, I don't want a cent off of it. But I want to make sure that it's being used to create solutions for juvenile diabetics. The ability for patients to be in control of their data, to know how their data is being used, and potentially to monetize their data cannot happen unless our AI is transparent, interpretable, explainable. So, on that basis, yes, I support the point about assurance. However, I don't think assurance by itself is an answer.
Yeah.
Patient control is the answer.
Mm.
Clinician
Well, I'm
control.
talking about this guy. Ooh, yeah.
It's pretty good.
Patient control is the answer. Physician control is the answer. Community control is the answer. So, one example I'll give is I live in rural Appalachia. Still one of the places in the United States which has several healthcare deserts compared to, let's say, urban places. in this
We also have healthcare deserts too, though, in urban places.
in urban
They're
places
everywhere.
too.
The whole of America is a healthcare desert. Weirdly, there's so much healthcare, but still
Correct.
deserts.
So my question is, why can't we use AI to bring things like telemedicine to the table?
Totally.
How can we use AI to change the payment regime on telemedicine?
Mm-hmm.
How do we measure not just activity, but outcomes?
Yeah.
Right? And so one of the challenges has always been this focus on activity, which has led to fee for service. And the lack of a focus on outcomes has also meant that accountable care never took off as much as it should have. So I really think AI is the great equalizer that equalizes organizations and individuals.
Love it.
Nice.
Yeah. Well, Prashant, give our audience one more tip for what's next in the next couple of years here, or just like the next month, maybe two, with AI and the new administration, and then we got to switch over to our next special guest.
I think we are in a wonderful time in our lives right now. AI is just getting started, and based on what we see, this means that I'll just say one thing. I think what AI represents is the democratization of technology and programming.
Yeah.
We went from assembly to COBOL to Visual Basic to React kind of frameworks. And today we are at a place where anybody who knows the business, knows the data, can build their own apps, including patients. And that's kind of what I like to see is let a billion flowers bloom and let us pick the best ones to put in the bouquet that we design on a daily
Love
basis.
it. Love
Nice,
it.
Prashant.
You're the
Thank
best.
you very much.
Well, thanks.
Thank you
We
for
look
coming
forward
on
to
the
running
show.
into you at the bar later.
Absolutely.
We'll see you very
yes.
soon.
All right.
Thank
All right.
you.
See you soon. Bye,
Oh,
Prashant. My gosh. All right.
All right,
Off we go.
next
We have-
guest
oh my
coming
God.
on live.
Okay, we need both of you on here because we have to recognize.
You gotta just jump in.
Yeah,
You gotta just
Just,
jump in.
just, we just need to see your face.
You just see the
oh my
comment.
God. Well, here, Erin, have a seat here. Okay. Thank you very much. It is my birthday. Okay, we just need to put her on the internet.
Everyone, look.
This
on the
is
internet.
the
That's
new reigning PR girl
Reigning PR
in
queen.
America in health IT. Yeah, she's the one we posted about. Greatest pitch ever.
Greatest
Oh my
pitch
gosh.
ever.
All right. Okay. So,
Check LinkedIn.
thank you very
So you
much.
just literally
Oh my
hold
gosh.
it at the bottom. There's
Okay.
no.
Is this
Yeah.
the report?
This is the root.
Oh
Well,
my
I don't
God.
want to tell you what your present is before you open it.
We already knew.
Okay. First, briefly introduce yourself, and then you can go to the report. Erin.
Absolutely. So I'm Erin Weber. I am the Chief Policy and Research Officer at CAQH, a provider and member data company that produces the annual CAQH Index Report.
And I believe that is what is in this birthday party bag. Oh my gosh.
As we've noted, today is Kat's birthday, and this is her birthday present. Oh,
Let's see, Lisa.
This is everybody's number one
Just
gift.
what
Y'all. The 2024 CAQH Index Report. Okay.
Amazing.
Jesus Christ.
Amazing.
What is even in here? Oh my gosh.
Lots
Just what
and
you always
lots of
wanted.
data.
Also, we're having a birthday drink at 4 o'clock at their booth, just in case anyone's
4
curious.
p.m.
Yes.
Everybody come.
Martinis.
Okay. Oh.
Yeah.
Oh my God.
Free martinis
Free
at the
martinis.
CAQH booth at 4 o'clock.
We're pretty fun. Yeah.
My
it's gonna be
birthday
amazing.
and the launch of this report.
Amazing.
Okay. What are the highlights, Erin? What's going on?
So let me tell you about this report. It tracks industry adoption of electronic transactions. So think about the revenue cycle, claims, eligibility, and the progress we've made over the past 10 years. The highlights, the industry has saved, last year we saved $222 billion by using electronic transactions, not picking up the phone, not faxing. The low light, there's still $20 billion
Yeah, I was gonna
more
say. I was
we
gonna
could
say.
be
What's
saving.
the rest that has
Yeah.
not been adopted?
Yeah.
And
Wild.
most of that is accumulated by the providers. So plans have, standardized a lot of things on their back ends. But if you're a provider and you're working with multiple health plans, every
100%.
process is a little bit different. And so it's not automated. You're picking up the phone and it takes minutes. A claim status transaction takes 18 minutes for a provider to complete over the phone. So just understanding where your claim is in the process, and you multiply that by the billions of claims that are going through the system every day, and it gets really expensive really fast.
And also just like such a just an engine of the business of healthcare, right?
Yes.
And there's so much. I mean, we saw what can happen when this information gets compromised with massive outages and hacks, and we saw the impact impact on providers and the access to care. Like this is how the money gets moved, right?
Yeah, so the report is going to be really interesting. So this report has 2023 data, but we did do some supplemental questions around the Change Healthcare incident to understand what were the disruptions. So that follow-up issue brief will be coming out soon.
Love it.
But next year's report is really going to be impacted by that data, and we expect to see some strange things in the data next year.
So I just like flip through here and I see prior auth. Tell us about your thoughts on prior auth.
Yeah, so prior auth is one of the, no surprise here, least automated transactions. 35% of prior authorizations are conducted electronically right now. So
35%.
35%.
That's it.
That's it.
That's
Most of the
really
other
sad.
transactions are in the 80s and 90s.
That's so sad.
So yeah, it's
Wow.
like
I wonder why everyone hates prior
I don't know,
authorization.
weird.
yeah,
I don't know.
good question.
Yeah.
I will say, I think one of the reasons the industry hasn't invested in automating prior auth is we've been in this like wait and see period for the longest time around the regulations. Is it going to be an X12 standard? Is it going to be FHIR? And so now we have the new CMS 0057, really exciting, but we're just starting to implement it. So we expect that number to go up over the next few years, but we're not quite there yet.
And it just takes so long, right? That's my like long-standing critique of all of these regulations is that they get announced, there's a lot of negotiation and pushback from the industry potentially, and then the implementation date is like 2029.
Right. Well, and you got to think of all the years before to create the standard.
Right.
So it's like
Do you
10
think
years.
the new administration might just unalive prior auth?
Might what?
Unalive. She means
Unalive.
kill.
I mean, I think anything's possible in the new administration.
Well, right.
We're not about to
Who
participate
knows?
on that.
Who knows?
I
I mean, the reality is like the situation with prior authorization and in particular Medicare Advantage plans really leaning hard into prior authorization has resulted in providers starting to want to not take Medicare Advantage anymore, right? First and foremost. It's also a very complicated business from a financial perspective, and some big players are really successful and others are not. And so, if a big driver of prior auth is Medicare Advantage, and Medicare Advantage is, getting a lot of downward pressure, maybe it will also just kind of tail off or taper off a bit.
Yeah.
It's very unpopular.
Yeah, it's possible. And I think too, there are ways to improve prior authorization beyond just getting rid of it and making it easier, more straightforward, more consistent between plans. So I think there's a lot of options on the table. It's just, are we willing to go there? And I think we'll see.
I really feel for providers who are in, whether it's a physician practice, a larger provider hospital, who are obviously dealing with so many different plans, payers and plans and requirements. I mean, did you in the creation of this report, did you talk to individuals? Like tell us more about how you actually did this.
Yeah, so we get data from health plans representing about 63% of covered lives in the US. And then we work with about 600 provider organizations, a lot of smaller practices. And this year, what we added were provider focus groups to really understand the pain that they're feeling. So there's actual quotes about the provider experience in the report this time. And we took it a step farther and then also talked about the patient impact. Because all of these transactions, they have an impact on the patient. And if we can save some provider time from, being stuck on calls, whether it's the front office staff or the nurse in the back trying to get a prior auth through, that makes a big difference for the patients as well. Things are happening more quickly. But it's taking time.
In one of my recent emergency medical appointments over the weekend, I got to watch a medical doctor trying to call the pharmacy and being put on hold. And you could imagine just how much time is spent on these non-electronic, claims and non-electronic transactions of various types, right?
Yeah.
Whether it's putting an order in or trying to deal with a prior auth issue, right? It's just literal time.
It is. And the other thing that's really interesting in the report is the impact of volume as well. So eligibility, 96% of the time that transaction is done electronically. That sounds great. but there's 28 billion eligibility transactions a year. So that 4%, if we could do that 4%, it's $12 billion in savings still.
Wow, the
So-
long tail. The long tail. Long tail is long.
Yeah,
Yeah.
definitely.
Well, tell us about what some of. Do you have any favorite quotes from providers?
Oh, favorite quotes from the
Are they just
providers.
mad all the time?
You know, I think I mean, they're frustrated. It is,
Yes.
I mean,
They're just
to
mad.
be honest.
They're just mad.
You know, they're mad, but they're also optimistic. And I think they're concerned about whether their investment in their own technology will actually be something
Oh, valid question.
that's of
Yeah.
value for them.
Super
And
valid
so-
question, because they were pushed, of course, to adopt electronic health records, and now they're like, and
They haven't seen
we're still fact
results. So it's reports like this are important because you can tell the ROI story.
Yeah.
We know that this report internal health plan provider analysis around investments. We know that policymakers are
Nice.
using it. So it's really helpful when you have some concrete data behind. If you do this, there will be value
Yeah.
on the back end.
yeah, definitely.
Interesting. So, like we never prepped for this show. So, we were going in the elevator with Miriam Paramore yesterday. You may know Miriam. She was involved in early EDI, and she was involved in like the first U.S. Healthcare Efficiency Index, which I think you all took over
Yes.
years and years ago. Not like yesterday. And
It was
Lisa-
'cause we took it over from Embion, which
Right.
that tells you how
Yeah.
long ago it was.
Yes, which became Change Healthcare, in case anyone's paying attention to the acquisition world. But we were in the elevator with Miriam, and I think she was asking us, like, what do we think of deregulation in general? Like, what's going to happen? And we largely deal with like clinical data exchange in our universes. And I was like, deregulation's awesome. And then Miriam said something really thoughtful. You have to correct me, but this is why we were getting more wine and she was getting water, like a good corporate executive. And she said, well, for me, we all hated the EDI standards. We all hated that. But here we are today, and it's mostly electronic pipes now. So I think her point was like, yeah, we're all going to hate it, but like maybe it's not so bad. I don't know.
And also, there's not a perfect standard. I think a lot of people had major issues with X12 for a long time. And I think the thing that's most annoying to me about that transition and the CMS rule is that it took so freaking long.
That's what I was
There
gonna
were
say.
so many years of hand wringing and I don't know if we're ready to do it. It's like, you kind of just have to do it. We wasted how many years complaining about it? It's like, we could have changed it and moved forward, right? It's not,
100%.
you're not going to love the data. There's going to be problems. Like, data standards are not perfect, but
Yeah.
we do need to move to electronic transactions for all of this.
Yeah.
It has to get off the providers.
I think that there is a role for policy
Yeah.
here and regulation. I just think we have to figure out how to do it more quickly
Yes.
and to allow more flexibility.
Yes.
So, right now these HIPAA standards that are being used, they were developed 15 plus years ago at
The
this
world was
point.
very different.
Exactly. And so how can we move things forward at the pace of innovation without leaving these small providers behind? And I think there's some creative ways to think about that.
Like what? What are we pushing? What's the 2025 agenda?
I mean, so within ONC, they have this SVAP process, which is how they evolve their standards more quickly. So I think that's something we could look at in this space. I think also mandating a higher level standard and then giving, whether it's the standards development organization or the industry, the flexibility to update that standard outside the scope of the regulatory environment enables a lot more progress.
Yeah, that's absolutely true. That's awesome.
Okay, cool. Well, I'm into it. Well, what else would you like to tell our loyal fans?
I mean, come join us for martinis later today. The index report is on our website. It's available for free to download. We really encourage you to use it as a resource. We would also love to hear from the industry about how we can improve this. What else should we be tracking and looking at as we go forward in this interoperability journey?
I feel like this is something we should hand to Brendan Keeler.
Oh yeah,
and tell him
totally.
to summarize it
Yeah.
for us.
Brendan AI.
Yeah.
Brendan AI. This is awesome. Thank you so
thank you
much.
so
And,
much.
and
Yeah,
we're gonna see you
absolutely.
guys
Thanks
at
for having
4.
us.
If you're here, we'll see you at 4. If not, we'll find it online and we're excited. Yeah,
Sounds great.
Thank
Awesome.
you.
Great to meet you.
Awesome. Thank you.
Thank you so much.
All right,
Thank
we got
you.
we had another guest coming in hot,
Oh my gosh, we've got like
as per usual.
oh my gosh, and I mean
Oh.
it's not required. I'm 42, so like I don't really need presents. Like I don't need. you know, I've had a few. Well, welcome, doctors. Oh,
year, so
it's soon, very soon. Well, I love the whole vibe. Oh,
thank you.
So you got to hold this, but this is a low budget operation. Just do like that.
Got it. There you
Just
go.
hold it close to your mouth.
Adorable.
So, introduce yourself.
Hello, I'm Stephanie Lahr. I'm an internal medicine physician by background, but now
Love doctors.
rocked my way over into the vendor space, and I've been working at an AI smart hospital platform company for about 2.5 years.
Ah,
cool.
so AI smart platform. The only one. Are we talking about? And I apologize to give you an analog, but Care AI. Those guys. Similar?
We know them.
Okay. Okay. But are we in the
We
same,
know them.
we're in the same space?
She's all, we know them, and
We're
in the same space. Yes.
Okay. So tell us what that even means, because while I've heard those words before, so do other companies, I don't actually know what we're talking about.
Yeah. Well, so I'll rewind a little bit. The founder of our company is another physician, anesthesiologist, and his concept, like he didn't wake up one morning and think, I'm going to create a smart hospital with AI. He woke up and said, I'm angry and frustrated about medicine and the way we deliver care and the ridiculous things friction things that happen every day. What are we going to do? And how are we going to leverage technology in more advanced, sophisticated ways to solve that problem? And he thought, well, if we could see and hear, speak, and know where things are in space, basically replicate human senses with sensors, then maybe we could bring automation to the bedside in a way that then reduces those high friction things. So the smart hospital platform is, a deployment of sensor-based technologies, cameras, speakers, microphones, RTLS systems that kind of can, sense where things are in space, and then bringing them together to automate documentation, automate communication, provide, high quality data, because that's one of our challenges is we've got all this data to crunch and most of it's not worth crunching. So it's been super fun. We set it on top of a virtual care platform, knowing that if our caregivers, if the physicians and nurses are interacting with a camera and a speaker and a microphone and with the patients, then we get them comfortable with that. And that's how we can train the technology. Artificial intelligence, particularly computer vision, that's going to be leveraged in a health system. It needs to be trained there.
Yeah.
And we need those real environments. So it creates kind of a whole ecosystem.
So what is like a scenario or a clinical situation that might be affected in a positive way by this?
Yeah. So a simple one. And again, this was one of the first ones that he developed because he's an anesthesiologist and was in and out of the OR all the time. So imagine in an OR, a patient is rolled into the room. The very first thing that's supposed to happen while you're getting that patient comfortable, making sure they're the right person there for the right thing, is also somebody supposed to run over to the EMR computer and click a box that says the patient's now in the room.
Cool.
Yeah. So just move them to the bed and click the box across the room. And then when you're done with that, get them to the bed. And then when this next stage occurs, go and click a box so that we know that stage of the case is underway. It's not the most effective. Missed and or like, why do you need we really need a human to do those things? So, you can train computer vision to understand that's a patient coming into the room. It's not a staff member. Like obviously there's learning that has to happen. You have to be sure it's the patient. We can see when the drape goes down. We can go, when the drape comes up. There are elements that need to happen post, each of those kind of events. There are safety elements, and it's really the sky is the limit. But that's just a very simple example of some of the high friction things. It's great information. We need that information, but so much of what we've done in healthcare is put it on the backs of our clinicians and say, hey, while you do all the important work of caring for the patient, click a million boxes. We want the boxes clicked. Let's just let somebody else do it.
Yeah. Love it. Love it. So what's like an actual outcome here? Like what's the benefit of all this? What actually happens? Like who wins?
Well, I think the provider wins by being able to focus on the care of the patient. The patient wins because that relationship is restored. When I remember years ago, there was an article that came out in JAMA. This was at the beginning of the, sort of EMR, meaningful use, whatever. And a pediatrician posted a picture in JAMA
that had been drawn by one of his patients. And it was a little girl on the exam table, and she's smiling, and the room is colorful and adorable. And the doctor that was taking care of her, she had him portrayed sitting at a computer with his back to her, looking at the screen. And he was mortified, right? He was like, that is not the doctor that I want to be, right? So this kind of technology can restore the relationship side back, allow the focus on the care. And then when you think about the data acquisition point, as we move toward things like precision medicine, which I've heard you guys, talk about with guests and things before, we're going to need super high quality data in order to do that. Mm-hmm. And this is a way to be able to capture that in a more effective way.
Yeah. What has been the response from health systems, hospitals, like tell us about that commercial aspect of it, and probably also why you're at ViVE.
Yeah. So when you tell people, I've said to many people, within the next 5 years, there will be a camera, a speaker, and a microphone in every patient room in every hospital in this country. And there are sometimes people that are like, wow, that's a little crazy. And I'm not, wait, how do I feel about that? Right. I mean, this idea from a privacy perspective, certainly patient rooms, there's a lot of, elements that need to happen to maintain dignity of a patient. And so there's a bit of a nervousness about that. So that can sometimes be an initial thought is, well, I don't know how I feel about that. The cameras are not recording. Right. There's no video that is, being stored in some library somewhere that can be identified later. So that's usually the first thing that we can let people know, that it's like a window into the room. And whether it's the clinicians that are using that through like virtual care. So that's a lot of kind of what we are doing is
there is a fair amount of virtual care happening in hospital settings now,
absolutely.
Right?
Yeah. And
specialists and whatever.
And this is a way to bring it together, right? So you use that same virtual care infrastructure to then add on automation to that, right? Give them cues about things that are happening and bring their attention to things. So people are getting, I think, more comfortable with that idea. And then as we think about burnout and the clinician shortage that we know we're going to have, even if everybody that went to medical school, nursing school, whatever, was completely happy and stayed in their jobs as long as they could, which they're not doing. But if they were, we still would not have enough. Right. And so it's how do we help them be able to do more, but feel good about that? And how do we help, the patients get better care and then solve those, that equation, which is not going to be solved any other way without automation.
Yeah.
So, one of the questions we often ask on the show, and there's like a new technology coming in that really is simplifying things. We always ask, who makes less money?
Who makes less money?
Yeah. You guys are here now. We're not clicking the boxes. Who's making less money? Sounds like the payers are still making the money.
Yeah. I'm like, if anything, hopefully they'll get higher quality data. So they're still going to get their cut of it. Would it be ridiculous to say maybe this is a technology where nobody makes less money?
I think
there's an expense to it.
Well, so sure. I think at least in the near term, there will be more expense. So this will increase the cost of care, in theory.
In theory,
yes. We don't know if there's like other things that will happen. The care will be so much higher quality that those are downstream effects, upstream effects. So in theory, you could say the downside is that this will increase spending.
It takes it's an upfront cost that requires that investment. But we are already seeing things where throughput is improved. So if you're talking about an emergency room that's sitting on 50 patients, trying to get them into the hospital, waiting for beds, and this automation and the combination of that with virtual care allows those patients to move through faster. So those 50 patients sit there less time. It doesn't, those kinds of things, nurses spending less time in overtime, turnover reducing. I mean, some of those things they're going to take a bit of time for those numbers to prove out. But it should be a win.
There, yeah. Very cool. Yeah, I always think I think in general the emergency room experience, there's probably so much that can be done before people get to the emergency room, and not everybody has access to the same technology, of course. And of course, in many cases, certain symptoms are so serious that you really should be seen by a human being. But I always wonder about really busy emergency rooms being able to really get people before they get into that waiting room.
Yeah, I think we are starting to see health systems evaluate what kind of like a virtual triage almost can look like before people come in. Obviously, EMTALA and other rules.
You've got to be treated.
Yeah,
all those things are true.
When you come in, then now we need to just figure out what the situation is. But I think a lot of patients feel the same way. I mean, when was the last time that you considered that you might have to go to the ER? That you're like, yay! I'm so excited. I've been waiting for my ER visit. Like, this is going to be so awesome. Yeah. And I'm sure it will cost almost nothing. And it will be an amazing experience that lasts, I'm sure, only 5 to 7 hours. And, will completely blow my entire day. So, there's a ton of opportunity, I think, on both sides, because patients, I think, also are looking for ways to not have to go to that next point. But, it takes time and investment to get there. And like you said, they have to have the access to those tools. But even for patients that don't, from an equity perspective, if it makes their experience in the ER better because others were able to go through another route, then, that could be a benefit as well. So, the emergency room is
also
definitely an experience that we can look at improving.
Yeah. Any final thoughts for our thousands of loyal fans? Anything else you want to share? How they can find you? Millions, thousands, hundreds.
Well, I mean, after watching you guys a couple times the last few days, I was like, feisty. And I don't know why anybody wouldn't watch. I've had to add it. So I guess what I would say is, you're bold. And I think this is a time to be bold. I think where we are in healthcare and technology and the world of what's happening around us is it's a time to take some risks and jump out there and be bold and jump into tough conversations. And I appreciate you guys for doing it.
Awesome. Keep your wits about you, America.
That's right.
Thank you.
All right,
Thanks for coming on the show.
Yeah, great to see you.
Final guest of our first hour.
Back to you. All right, we're almost stick with us. We're almost there.
All right, get up here. This is a budget operation. We're going to tell you how it goes. All right,
no music
you're going to hold this mic. We're going to share this one. And don't put your finger down here or it won't work.
All right.
So introduce yourself, sir.
Hi. I'm Steve Cagle. I'm the CEO of Clearwater. We're a cybersecurity and compliance firm focused on healthcare.
Awesome.
Why healthcare?
Well,
a lot of people trying to break into it.
Yeah, we've been doing it since 2009. Healthcare is an industry we're very passionate about in terms of helping patients and protecting patients, and technology is so important today in doing that. We have to ensure that the security and compliance we have around our technologies in healthcare are in place to make sure that we have availability of care and we protect patient information. So that is what we do.
Risk increasing, right? There's a huge amount of data being moved around, a lot of data being siloed in different repositories. Like, tell us about the risk environment, the threat environment.
Yeah, well, the threat environment has definitely increased substantially. So electronic protected health information is the most valuable information on the dark web. And when hospitals or health systems have ransomware attacks, it means patients can't get care. They walk out of the hospital, they can't get scans or treatments, prescriptions can't be prescribed to those patients that need care. So the threat environment has increased, but at the same time, technology has increased. We have all kinds of new systems. We're sharing it with third parties, treating patients outside the home. So this has rapidly expanded the environment that can be attacked. And this is causing ransomware attacks to be at record highs for the healthcare industry. Breaches, 184 million records reported as breached last year.
Wow.
So it is really a big problem in healthcare and something we need to address.
Do people pay ransoms? I think hospitals do a lot of times.
Yes, actually, hospitals,
with
unfortunately.
Cat's Bitcoin.
With all of my Bitcoin.
With all your Bitcoin. Well, you hope you have a lot of Bitcoin, because unfortunately
I don't anymore. I only buy it at the peak.
Okay.
And sell at the trough.
That's a good strategy.
Someone's got to do it.
Yeah. But joking aside, yes, healthcare pays ransom more than any other industry. It's about 2/3 of the time. And if you think about, a hospital not being able to deliver care, that's a really tough situation.
Why do they pay it more than other industries? Yeah. Is it because patients?
Yeah, it's because of patients. It's because, if you have a threat actor that has now encrypted all of your information, encrypted all of your systems, you cannot treat those patients in the same way that you could have. And, you want to get those systems back online as quickly as possible. Also, you don't want that information on the dark web. And if you look at some of the
But it
tactics,
is anyway. Like, if they already have your information, isn't it already there? This is what I don't know.
Is it already where?
I
On
mean,
the-
if a bad actor,
Are we in the dark web?
I'm sure we are. I'm sure we are. So if you're a hospital and you ransomware attack, they encrypt your systems and they say, pay us a bajillion Bitcoin, or we're gonna sell your information, whatever it is. Aren't we assuming it's already on the dark web?
Well, honor among thieves,
Oh
right?
my
I
God.
mean, that's a good question, right? And a lot of times
Never
they,
negotiate with terrorists.
a
is
lot
my-
of times you're absolutely
whatever.
right. So the FBI will tell you never to pay the ransom,
Yeah.
but a lot of organizations
just
still
do.
do, and some of it does end up on the dark web,
Mm.
and some of it doesn't.
Right.
Really unfortunate example. It was a hospital system that had images of breast cancer patients before and after
Wow.
pictures.
Wow.
They did not pay the ransom. Ended up on the dark web. They were
Jesus.
a terrible thing for the women, obviously, that were affected by that. They also paid $67 million in a class action lawsuit.
That's nothing though.
Hard decisions,
$67
right?
million
Wow.
is a rounding error for a health system, I would say.
For this particular hospital
was not.
system, I think it was, I
was
think
a
it
lot.
probably made a dent. Yeah, it's a lot. But I mean, the point is that it's a hard decision, right? When you're faced with a
Right.
situation where it could be life or death, or it could be private information like that,
Right.
very sensitive information. What do we do? And that is attracting more threat
Yeah.
actors. So, it kind of goes back to the importance of having strong security programs, risk analysis,
Mhm.
risk management, making those investments. As we make investments in IT,
Mhm.
we have to do the right things for the patients. as
Yeah.
well.
Where are you seeing is it still the case that it's just like almost always people clicking on things they shouldn't click on? Tell us how
Yeah.
how are these things actually still
Yeah.
happening today?
Top two areas that we see, definitely what you just mentioned, right? It's the social engineering attacks. It
Right.
is the sophistication of those attacks, where it's not just in Nigerian prince anymore, asking you to
Ah,
give the bank
My favorite
information.
one.
Yeah, get those quite a bit, but you've probably gotten text messages,
Yeah.
or maybe even people calling you.
Mhm.
And some of the things that they're doing are very sophisticated now because they're being enabled by AI.
Mhm.
So when somebody's getting a notice that says, hey, you need to update your information on the payroll site on your, otherwise you're not going to get your paycheck, people's reaction to that, they get really worried, right? Or when there's a crisis going on or something's happening where people are not really thinking the way that they normally would when they're not under stress. And the bad guys are taking advantage of those situations. They're even using tools like Microsoft Teams now, where they can send Teams messages. And they're pretending
Wow.
to be IT support. So that's number one. Number two, vulnerabilities. We're seeing an increase of vulnerabilities by 30%, and
Mhm.
year over year, very hard for healthcare organizations to keep up with that.
Yeah.
Sometimes they're not patched, and the rate at which these vulnerabilities can be exploited, much faster.
Mhm.
Again, the bad guys are taking all this Bitcoin and they are investing it, and they're
Reinvesting.
hiring really smart
Amazing.
people, and they're working together, they're organized, and that's what we're up against.
Growth industry, cybersecurity on the
Wow.
bad side.
Yes, if you're
Yeah.
in Russia or Iran or North Korea, it could be a great career path, for you.
Yeah. Oh yeah. I mean, I think I'm good for now. But
Okay.
so you're saying like the big way that people are or organizations are hacked from these more sophisticated scams, and then just like straight up hacking from vulnerabilities. Is there something else, or is it those two primarily?
Those are the two top ways that we're seeing organizations being, hacked, if you will, today. The other huge risk you have really is in the supply chain. So those things are not
That's
only
what I was gonna
happening in
ask,
your own
yeah.
organization,
Health tech companies,
health tech
healthcare IT companies.
Yeah, exactly. Right. So, if you think about a medical device or a pharmaceutical product, it goes through an FDA approval, and you actually have cybersecurity requirements now for FDA. That doesn't necessarily address all the previous devices that are out there that are legacy, that are not being updated. But a lot of these health technologies, many of them are doing very good things. They are thinking about security. In fact, I'll say our clients are definitely doing that. But a lot of them are not necessarily moving as quickly on that part of the technology as they should be. So you are seeing a lot of these attacks happening through the supply chain. We all know what happened with Change Healthcare last year.
Yep.
It affected like 70% of the providers. But even recently, blood services companies, New York Blood in New York, already in blood shortage, and you're seeing, again, bad guys are going to go to the areas where they can get the most leverage, right? And if they can get to multiple providers from one single vendor who doesn't have as good of a security program in place, they're going to do that.
Yeah. So we talk a lot about like policy. So we saw in the last administration we had all the change thing was like gigantic, right? Tons of hospitals getting attacked. And there wasn't necessarily like a super huge government response to that. Do you think anything's going to change under the Trump administration with regard to cybersecurity and healthcare?
That's a tough one. I think, it's anybody's guess.
So far,
what's
none
gonna
of our
happen
guests
on
have been
the,
willing to make any bets about what's going to happen.
Yeah.
Nobody wants to make any bets.
Lisa, making bets
We're just out here.
with Bitcoin.
what I will say is a couple things about the first Trump administration. So that administration, Trump actually put into place CISA, which is a cybersecurity infrastructure security agency. Also mandated that this cybersecurity framework would be adopted by all of the federal agencies.
Right.
And I think Trump is pretty focused on national security and worried about China and other threats that are coming, protecting this. So I like to think that the administration will continue to understand the importance of security in the healthcare sector. There are some real challenges in the healthcare sector in implementing the security that it needs because it is under-resourced, it is underfunded. It's regulated. There's HIPAA, right? Today there's HIPAA, but HIPAA is not necessarily interpreted or followed by all these organizations. Right. And enforcing more regulation on folks, I don't know if that's necessarily going to solve all the issues. I think it's important that we have a baseline, but what we really need is we need to have a more efficient way of helping these smaller organizations in particular to actually establish the controls, recognizing this is a threat to every patient, every person. It's not just the organization, right? It's our health system. That is important. So I would really hope that falls in line with the Trump agenda.
Awesome.
Yeah.
Well,
Same.
Totally.
Same.
We agree on that one. That's good advice. So where can our millions and billions of loyal followers find more about your work, what you guys do? Like, what would you like to leave our fans with?
Well, fans, we'd love for you to visit our website at clearwatersecurity.com.
Love it.
We have a tremendous amount of free educational material. So
Great.
that is how Clearwater has
Great.
established itself in the marketplace.
Nice.
I do a cyber briefing every single month,
Nice.
first Thursday of every month. And we always have a guest speaker coming on talking about a topic, but mainly what I cover is what's happened in the last 30 days. What should you do about it?
Prep?
Oh,
he probably preps. It seems
I
like he
prep
might
every
prep.
morning.
Like he preps. It seems like he preps.
We're in cybersecurity.
I rolled out of
We're
bed
preppers
at
by
like 8
definition,
a.m. So like I did not prep. Like I was still asleep this
We are
morning.
not a cybersecurity organization, so
We appreciate you prepping.
yeah, that's awesome. So you said what, every Thursday?
every first Thursday of every
Thursday.
month. Yes.
Check it out. Awesome. Thank you so much for coming on.
All right. Thanks for having me.
All
Enjoy
right.
the conversation.
I think we are. I think we're
You
done.
are our last guest. Off we
Okay.
go.
So everyone, we will be back this afternoon at 2:00
Central.
Whatever time zone we're in, Central. John Lynn was trying to break into our
Do
show.
you want to come do a
John, you
little
want
cameo,
to
John?
do a little cameo before we get out of
cameo?
here?
Yeah.
John, cameo.
You need to use the microphone.
I've always wanted to be on the show. I'm your biggest fan. And also,
See, fan.
happy birthday!
Oh! Look, the fandom is real.
Yeah.
All right. See you guys at 2. Thank you.
Bye, America.
Awesome.
All right.
Yay.
Thank you. That was
Good job.
fun.
Yeah. I mean.